Dan Smith, one of the surgeons here in Park Rapids, and our practice here is general surgery, but we do a large number of bariatric surgeries or weight loss surgeries, usually around 300 a year, and mostly gastric bypasses, some sleeve gastrectomies and bands, and I'm board certified in surgery and surgical critical care. Worked in the operating room and got to scrub in on quite a few cases as kind of an assistant, and that just lit a fire. At that point I knew for sure that surgery was what I wanted to do. I worked with the general surgeons in the rural hospital in Michigan, so I kind of knew in general, general surgery would be the thing I wanted to do at that point. And during medical school, none of the other kind of specialties really kind of seemed as fun as general surgery would be. And then the bariatric surgery thing kind of blossomed to some extent on itself. One of the real thrills is seeing a successful weight loss surgery patient. For instance, the people with type 2 diabetes, about 80% of them go into full long-term remission, meaning they're off insulin, they're off medications, and have normal blood sugars, hemoglobin A1Cs. And to render someone from being a diabetic to essentially not being a diabetic is just one of the great medical home runs you can hit. Well, one of the things is a Center of Excellence in Bariatric Surgery. We're required as part of that status to continue to follow those people over a lifetime, and that makes sure that we, as much as possible, keep people out of trouble over the long haul as far as vitamin use and things like that. My wife and I have 5 kids, so we're pretty busy with that. And we live on a lake north of Park Rapids. We do a lot of fishing, a lot of muskie fishing, and we also do quite a bit of sturgeon fishing up further north.